an avenue for us to provide support and help to those mind ourselves about some of the activities of the agency this past week, and that will come in our news highlight segment, which will be taken by our regular Blessing Tafa and her compatriot there. Blessing, let's have the updates. Thank you.
Thank you, sir. Good day to everyone, and thank you for joining us on this week's X Space. My name is Blessing Tarfa, and here are the NDLEA news highlights for the week. First, the headlines. NDLEA smashes international drug syndicate, seizes loud consignments, arrests 5 members. Intercepts 4,752 kilograms cannabis concealed in gas tanker in Abuja. Nabs ex-convict with assorted illicit drugs in Osun. Operatives of the National Drug Law Enforcement Agency (NDLEA) have smashed an international drug syndicate with networks in parts of Nigeria, South Africa, and Thailand. No fewer than 5 members of the cartel were arrested in a 2-week intelligence-led operations in Lagos, Abia, and Anambra states, following the seizure of their illicit drug consignments at the narco import shed of the Murtala Mohammed International Airport, MMIA, Ikeja, Lagos. The unraveling of the drug cartel started on Sunday, 20th April, when their cargo of 4 big suitcases arrived at the narco shed on an Air Peace airline flight from Johannesburg, South Africa. After days of close monitoring and investigation, the first suspect, Umed Chisom Peter, was arrested on Wednesday, 24th April, after he showed up to pick 2 of the suitcases containing Loud, a synthetic strain of cannabis owned by a Thailand-based member of the syndicate, Obo Michael. The consignment of 4 parcels was concealed in false bottoms of the 2 suitcases, while the 4 suitcases contained a total of 17.6 kilograms Loud and drug candies. Another member of the syndicate, Mrs. Chiwendu Uche Ube, whose South Africa-based husband, Aloysius Uche Ube, said some of the consignments, was traced to Anambra State, where NDLEA officers arrested her on Saturday, 27 April, while attempting to collect the drug parcel sent to her by her husband. 2 other suspects, Oya Jako Francis Chimezie and Naji Valentine Chukwukere, with links to the cartel, were also arrested in parts of Lagos on Monday, 29 April. The arrest led to another operation in Abia State, where Mrs. Chinazo Osigwe was arrested when she was to pick up some of the parcels containing Loud and drug candy sent by her husband, Osigwe Chidebere Anthony, who is equally operating from South Africa. Meanwhile, NDLEA operatives on stop-and-search operation along Abuja-Abaji Highway on Wednesday, 1st May, intercepted a 40-foot gas container marked RBC-77XG, and upon a thorough search discovered 511 jumbo sacks of cannabis sativa weighing 4,752 kilograms concealed in the gas tank compartment of the truck. The consignment was loaded into the tanker in Ondo State and meant to be delivered in Abuja for further distribution. 4 suspects, Efa Abel Mikel, 39, Ebigide Cyril, 29, AJ Monday, 41, and Friday Benson Chukudi, 39, have been arrested in connection with the seizure. While 2 suspects, Aminu Umar, 25, and Anas Umar, 22, were arrested with 207.1 kilograms of cannabis sativa in their house at Ongwanrini, Basawa, Samaru, Zaria, Kaduna State on Monday, 29 April. Bashir Umar, 35, was nabbed at Ladanai Hotoro area of Kano on Friday, 3rd May, with 194 bottles of codeine syrup. In Osun State, NDLEA operatives on Wednesday, 1st May, arrested an ex-convict, 51-year-old Suleiman Usman, who is currently facing trial for another drug offense at the Federal High Court, Okshobor. At the time of his latest arrest at Okini Town, Suleiman was found in possession of 4.4 grams of cocaine, 28.5 kilograms of cannabis sativa, 20 tabs of rohypnol, weighing 6.2 grams, and 812 pills of tramadol. The following day, Thursday, 2nd May, NDLEA operatives at Agbara Checkpoint, Semi-Border, Badagry, Lagos, intercepted a Toyota Camry car marked KJA 825FT, conveying 113 jumbo parcels of cannabis with a total weight of 64 kilograms. The driver, Charles Amoni, was promptly arrested. In Bauchi State, NDLEA operatives on patrol along Bauchi-Jos Road on Monday, 29 April, arrested Clement Chukwuka, 39, 595 bottles of codeine, 38,260 pills, diazepam, while another suspect, Friday Ibochi, was nabbed at NDLEA Aloma Junction, Otupa, Benue State, Tuesday, 30th April, with 66 blocks of cannabis weighing 33 kilograms. In the same vein, 42-year-old Ifeanyi Stanley was arrested with 12 kilograms of the same substance at Swali Jetai, Yanagwa, Bayelsa State. While commending the officers and men of the MMIA, FCT, Kano, Kaduna, Oshun, Seme, Bayelsa, Bauchi, and Benue commands of the agency for their outstanding feats in the past week, the Chairman Chief Executive Officer of NDLEA, Brigadier General Mohammed Ubamaro retired, equally applauded their counterparts in all the commands across the country for intensifying their water advocacy lectures. That's it on arrest and seizures. Over to you, Comfort.
Thank you, Blessing. My name is Comfort Folorunsho, and here are some of the water activities across the country for the week. The National Drug Law Enforcement Agency, through the World Against Drug Abuse Water Initiative, has embarked on groundbreaking advocacy campaign sweeping across states and communities. The NDLEA water campaign is igniting a beacon of hope, rallying communities far and wide to join forces in the fight against substance abuse. Monday, 29th April 2024, the Imo State Command delivered a water sensitization lecture to both students and teachers of New Era Royal Academy in Umudu, Umbiri, Mbatolu local government. On Tuesday, 30th April, the Ogun State Command targeted the students of Lafenwa High School Senior, Abeokuta, emphasizing the dangers of abusing illicit substances. In the meantime, the Lagos State Command visited the First Lady of the state, Dr. Mrs. Ibijoke Sanwo-Olu, seeking her support in the fight against drug abuse, while the Abia State Command delivered a lecture to nursing students at Aba campus of Abia State University. On the same Tuesday, students of El Shaddai Ultra Modern Schools, DUSE, received water sensitization lecture from the Jigawa State Command. Thursday, 2nd May, Enugu State Command reached out to Skybrain International School in Enugu, SDK, where students were educated on the consequences of substance abuse, underscoring the importance of living a drug-free life. On Friday, 3rd May, the Ondo State Command delivered a similar sensitization lecture to students of Ikimogun Community Grammar School, Bawanuduro in Ondo East local government. In the same vein, the Katsina State Command reached out to intending pilgrims, enlightening them on the hazard associated with illicit drug trade. The Osun State Command wrapped up the week by delivering a lecture to the Olobatoke of Obaoke, Oba Iyonu Bamidele Yusuf and his chiefs. That's the update for this week, and I hand you over to our host, Mr. Femi Babafemi.
All right, thank you very much, our beautiful ladies there. That's Blessing, Tafa, and Comfort for Laurentia. Now, welcome back from the news highlight segment. Quickly, let's remind ourselves about some of the rules guiding our process of engagement on this platform. That's this program in particular. Please, let's ensure that when we approve you to be on the speakers corner, we've had to take 2 people out of that space because they were interrupting the flow of conversation when the ladies were updating us with some of the highlights of the activities of the agency in the past week. So please, when you are approved to be on the speakers corner, ensure that you remain muted until after our guest presentation, and we ask individuals to unmute themselves. We'll definitely call your name to unmute you when it gets to you. The moment you indicate that you would like to speak, we'll invite you, call your name, and invite you to unmute yourself. But before then, please let all remain muted so that we can enjoy the flow of our conversation on this platform today. And I would also like to join us to please ensure that our questions and contributions are made or delivered in few seconds so that we can allow other people to make their own contribution or ask their questions. Then unauthorized interruption, as we have seen. We also don't discuss politics here, strictly on how we can solve or curb this scourge in our society and in our communities across the country. I would always appreciate your cooperation at all times. Thank you. Now to make to our guest, let me quickly update us or tell us something about the NDLA's 24/7 service, psychosocial service for as many of our people wherever they are across Nigeria, whether south, southeast, southwest of Nigeria, for as many that are struggling with substance abuse, friends or family members going through this. Please, all you need to do, we have on the experts, our counselors, and mental health experts in general, as well as our psychiatric doctors. They are working there 24/7, every day of the week, every minute, every second. You have all of these professionals at the end of the call, at the other side of the call, ready to speak to you. And all you need to do toll free help, and the number to call is 0800 102030 for 800 102040. Please feel free to call this line at the end of the call to assist you, to support you. Feel free, because um, no cause to be scared of being judged or being stigmatized. So that's about the agencies. And again, I think I would like to add to that another thing. Service is language sensitive. That means that if you cannot speak the official language, that's the English or even the Pidgin, you have the opportunity to from our call center, because our experts there with listened to and attended to. So please feel of this great opportunity by the NDLA and our partners, so that so as to bring help right to you wherever you are located. Now let's introduce our guest for today, who is Dr. Shizom Ugona, a mental health and substance use disorder specialist. And let me say this more about her. Ugona is a senior medical officer at the Olesta Recovery and Wellbeing Center. That's a mental health care facility located in Abuja. She is a mental health and substance. He described her earlier. She is a mental health and substance abuse disorder specialist, a dedicated advocate for mental health awareness. Um, Her work focuses on a holistic approach to mental illnesses, addictions treatment, behavioral health, as well as lifestyle and well-being. So definitely, we have not picked the wrong person, but indeed the right behavioral. That's some drug abuse and behavioral health today. So please join me in welcoming Dr. Shizo Bogon as I invite her to unmute herself while we listen to her discuss our topic for today, that's drug abuse and behavioral health, early signs and recovery options, for the next 40 minutes. Please go ahead with your presentation, Dr. Shizo.
Thank you, Mr. Femi. I hope I'm audible enough. Good morning.
We are hearing you loud from across the world. Thank you.
Okay, thank you. Good morning, good afternoon, good evening, bonjour, bonsoir, from wherever you are listening to me. It's such a delight to be here in this forum and talk about drug abuse and behavioral health, early signs and recovery options. My name is Dr. Chisom, like Dr. Chisom Ugona, like you said earlier, and I hope that by the time we're done, we'll be able to get at least one thing to go home with. thought patterns and emotional responses can affect how people react to their daily lives. For instance, someone that is an alcoholic that wants to stop drinking, what a behavior by identifying the thoughts, the feelings, the stressors. What do you think about before you drink alcohol? What do you feel? Are there things that make you go use alcohol as a form of coping mechanism? So the professional can then work with them to find a healthier ways to manage these thoughts and feelings and stressors. A mental health treatment plan might primarily focus on addressing symptoms such as mood, anxiety, delusions, lethargy, and so much more. Whereas a behavioral health plan will focus on symptoms such as substance misuse, poor personal hygiene, eating disorders, difficult relationships with friends and family, or social isolation. So to dive right into it, drug abuse, the early signs of drug abuse. I'm going to say this. Signs and symptoms may vary widely from person to person, and it's also dependent on factors like the substance being abused, the length of use. The signs you will see in someone that has been using for 10 years may not probably be the same as someone that's been using for 1 year. The severity is drug abuse signs are also dependent on the severity. Someone that's an occasional someone that smokes marijuana occasionally, maybe once in a month, you can't be compared to someone that smokes every day. And it also depends on the individual's personality. Excuse me. In the early stages, a person might not show telltale signs of a full-blown drug problem or addiction. There's something we call high functioning addicts or drug users. This is simply someone who is struggling with drug abuse but can outwardly project normalcy. They can still hold down jobs, they can pay their bills, just do their normal day-to-day activities and generally deceive the people around them at home and at work and at school that they are fine. I'm going to give an example. Let's say I have a client. I've had a client in the past. Let's call him CK. When CK was admitted and during the course of our conversations, CK did not know why. He was like, why am I admitted? It was my girlfriend that introduced me to using so and so and so. But she still goes to work. But how come I'm now the one being locked up, in quotes? So I made him understand that his girlfriend was more or less high functioning addict. She could use and still function normally without people even getting to know that she was using. So when it comes to certain, in quotes, common social behaviors like drinking or smoking, I'm sure most of us here, take the occasional drink. Some people even take cigarettes, so it might be a bit difficult to determine if there's an addiction or abuse problem for people that are social drinkers. You see people that say, oh, I use cigarettes to ease off stress, or when I'm tense, I take alcohol. So what looks like a form of stress management may in actual sense be an abuse that is happening, but you wouldn't really know. But a real addiction, if left untreated, can develop into a debilitating habit or an increased risk of mental illness. So going straight to some of the early signs of drug abuse, the first I'm going to talk about is changes in personality and behaviors. And under this, first we're going to talk about withdrawal from social activities, hobbies that used to be important to them. Example, someone that used to like to play football, basketball, a very sporty person, just gradually or even suddenly stops doing all this. This could be a sign. People that codeine is their drug of choice. We all know that codeine has a way of slowing people down, and it makes people more socially withdrawn. Remember what I said earlier about drug abuse being dependent on on an individual's personality. You can hear something like, oh, my son is a naturally very quiet person. So when this naturally very quiet person starts to take codeine, they go further into their shells. They lose interest in anyone or things around them. They always want to be in their rooms all the time, and something like that. Under changes in behavior and personality, I'm going to talk about neglecting relationships. They tend to withdraw from family members, from friends, from their partners. I once asked an addict why he stopped communicating with his family, and he said he generally wanted to avoid them out of guilt because he felt that if he saw or spoke to them in person, they would somehow be able to guess and know that he's a user. Another point here is missing obligations like work, school. Cast your mind back to the person I used as an example, CK. CK's girlfriend could go to work, but because of his drug use, he stopped going to work. I know of another person I've managed in the past. Very big boy, is a director. But because of the nature of his job, he makes a lot of money. He used to make a lot of money then. And his drug of choice was crack. And we all know crack is expensive. So he was able to indulge very well with on crack. And this led him to delegating his duties to workers who he was supposed to be in charge of. Workers that were not even qualified to handle such responsibilities. The result of this was, there were always a lot of issues, there were a lot of errors, there were a lot of queries. This continued for a while, and the end result was termination of his work. To give another example, another person I've managed in the past, big boy working in a very major place, his drug of choice also was codeine. He gradually there was a gradual decline at work. The days he even manages to go to work, he's always sleeping, he's dozing off at intervals, and he gradually started missing work 1 day, 2 days, till he stopped going entirely. It was his wife that raised the alarm, informed his parents, who in turn sought help for him. He got better and he was able to go back to work. For younger people that are students, what the usual pattern is missing classes, struggling to finish school. In fact, if during the course of seeing someone and you hear, oh, I went to 4 or 5 different universities, it begs the question, why did you go to 4 or 5? Why didn't you finish in one? So what you keep hearing is, oh, I wasn't going to class, I was missing tests, I was missing exams, I had a lot of carryovers. And for schools that have very strong drug search rules, or they found some drugs in my possession, and that's why they were probably suspended or rusticated from school. All right. Another one under change in behavior and character is increase in risk-taking tendencies, and especially to get drugs or to continue certain behaviors. People that use drugs tend to do things that they normally wouldn't do to get drugs. Example, stealing. A former client of mine from a very affluent family resorted to stealing his mother's jewelry to either sell or give directly to the dealer. And most times, he wouldn't even get the worth of the jewelry he's pawning off to them. So his mom didn't notice at first because they're rich. She had 2 boxes of jewelry. One big box was for her normal, regular, everyday jewelry. The other one was for occasions. And they hadn't gone to any occasion in a while. So fast forward to 2, 3, 4 months. They had a function to go to. So she went to her jewelry box, of course, to get the jewelry she would use. I noticed that about 60 to 70% of her jewelry were gone. So after they went out, they had to do a lot of investigations, looking at the CCTV camera at home, and it was discovered that it was her son that was taking them. He also confessed to taking other things in the house as well to sell, just to be able to get the drugs he needed. Another risk-taking behavior is sex for drugs. Girls tend to perform, a lot of people generally, a lot of users tend to perform sexual activities with dealers in order to be given drugs. This is seen a lot of times amongst girls who cannot service their drug use. I managed a patient once. It was her family that had to intervene because she was, she was practically living with this dealer in a hotel just for her to be able to get drugs. And when we were talking, she said, oh, sometimes I have to do this, I have to do that. Even things she has never done, she had to try them because she needed the drugs from the dealer. Another change is unusual need for money and unexplained financial problems. I have someone I used to manage. When the family brought him, one of the things they said was he used to be on an allowance of 100,000 every month. But all of a sudden, he started asking for more. So when they sat back and did the math, they found out that what he was even collecting was almost equaling 500k every month. So they stopped giving him entirely. What he resorted to do was now to take phone numbers from his father's phone, his sister's phone, take some numbers, calling them, asking them for money. And how did they find out? His sister's boyfriend called her and they were talking. And he goes, "Oh, how's your brother doing? I heard he told me he broke his arm and he's in the hospital." And she's like, "No, my brother." Like, "Yes, that's what he told me. That in fact, he told him to send him 300,000 and he did." And she was like, "My brother is right here and he doesn't have a broken arm." So they had to go back, confront him, they beat him, and he was now able to say, "Oh, this is what he has been doing." So when they confronted some of their friends, they were like, "Yes, this is what he has been doing," but they didn't have the heart to come and tell them, "Oh, your brother is begging us for money." So when someone has a drug abuse problem and they need to fund it, they usually resort to doing things like this. Another change in character or behavior is changes in friends and activities. Um, you may notice an increase in alienation over time, or most of them tend to hang out with a completely new set of friends. Understand that drug abusers tend to surround themselves with others who will encourage their habits. So another major change is sudden change in physical health, appearance, and hygiene. Another way to recognize, one of the ways to recognize drug abusers is paying attention to your friends, your family members' physical health or appearance. A lot of times, the signs are usually there. You could see bloodshot or glazed eyes. They have this blank look about them, unexplained injuries and marks on the body. You can look at their arms. You could see needle marks on their thighs, needle marks. Abrupt change in weight. It's either weight gain or weight loss, but a lot of times it's usually weight loss. But emotional and mental changes as well, which could point to drug abuse, like sudden changes in mood that comes with the use of codeine, aggressive behavior that could stem from crystal meth, paranoia seen in crack users, suicidal thoughts, general lack of motivation for school and work. Like I said earlier, these signs can vary depending on the individual and the substance being abused. If you're here listening and you notice these signs in yourself or in someone else, it is important to seek help and support right away. It's never too late. There's this saying I always say, I want to quote Nelson Mandela, it always seems impossible until it's done. I'm quoting Vince Lombardi, once you learn to quit, it becomes a habit. So some of the early signs of behavioral health problems, you'd see that some of the things I'll mention here are already said in some of the early signs of drug abuse because they are somehow interwoven. for the behavioral health problems, there may not be physical tests or scans to reliably indicate when a person has developed behavioral issues. However, one can look out for the following as possible signs: persistent feelings of sadness, anxiety, or anger; changes in sleep pattern, either sleeping too much or sleeping too little; changes in eating patterns, either eating too much or eating too little; using mood-altering substances, including alcohol and nicotine, more frequently. In fact, that's just generally abusing substances. I managed someone more recently, and how did they notice he was going through stuff? His sister said that they all knew in the house that he takes the occasional marijuana once in a while, but she noticed that he started using a whole lot. Every day she comes to his room, it's smelling. So probing further, he said that he was taking it because he needed to numb his pain and feelings. Apparently, he saw years ago, he saw his dad do something which didn't sit well with him. So it kind of made him feel some type of way, and he's been battling the ever since. So in order not to even remember, or he started using more frequently. And she knew this because it wasn't normal for him. So she knew it was a red flag. Okay. Another early sign is difficulty in concentrating, seen in adults with anxiety, depression, being stressed out. Also seen in children and in younger children as well. There could be decreased performance at work or school. They are missing work, not getting enough work done, cutting classes, failing schoolwork, withdrawing from friends and family and colleagues, being unable to complete their daily tasks that they usually would do, like getting to work, cooking a meal, engaging in risky behaviors, avoiding activities they would normally enjoy, having suicidal thoughts, thinking of causing harm to themselves or even to other people, hearing voices, seeing things that other people can't see. These are just a few. So for recovery options for drug abuse, the process of recovery is highly personal and occurs through different pathways. While there's no single treatment method, while no single treatment method is the same or right for everyone, recovery is possible. There are evidence-based guidelines available to assist doctors with choosing the right treatment options. These guidelines help evaluate a person's clinical needs and their situations to match them with the right care that they need in the most appropriate available setting. So depending on the type of drug being abused, there are options which may include: 1, the very popular one, detoxification. The process of what is detoxification? This is the process of clearing the body of drugs under medical supervision, of course, and managing withdrawal symptoms as needed. There are various forms of drug detox, but each is designed to meet the needs of a particular type of addiction and a specific type of individual. Detox process or timeline, it varies from drug to drug. For stimulants, they vary. Opioids is different. Alcohol is different. So the first detox is the social or non-medical detox. This involves the individual stopping the use of the drugs entirely, something we call going cold turkey, while under the care of treatment professionals. While this method can be successful, while this method can help people successfully withdraw from psychoactive substances, it is important to note that it's not without its challenges. Some of the challenges we see are unpleasant withdrawal symptoms, which could even be very severe, danger of relapse, which in turn can lead to an overdose. So let me create this scenario. They've been in a rehab or they've been secluded for 4, 5, 6 months, and drug abuse substance abuse is actually a mental illness, so it takes time for the brain to heal. So let's say they've stayed for a while without using and the brain has healed, right? Their tolerance to the particular substance they were using in the past is markedly down. Imagine someone that was using 1 gram, 2 grams, 3 grams of a particular substance. He stayed away for a long time and he goes back to use that 1 gram. The brain doesn't recognize it anymore. So that 1 gram is an overdose. This is someone that was using even more than that 1 gram, but that 1 gram will be an overdose. So those are some of the challenges with going cold turkey. Another form of detox is the medical detox. Unlike the natural cold turkey method, medical detox provides patients with medications in order to prevent and address complications, which leads me to the second recovery option, medication-assisted treatment. So for specific conditions like opioid users, they may require medications as their first course of treatment. This will help with cravings, withdrawal symptoms, and also prevent medical complications like reduce methadone. We could use naloxone. There are a lot of medications you can use for opioid users. So this, when combined with counseling and behavioral therapies, can help prevent relapse and promote long-term sobriety. Another recovery option is the inpatient rehabilitation. This is when a full-time facility provides a supportive environment to help people recover without distractions or temptations. But please, it's good to note that, like I said, all this is dependent on a lot of things that varies from person to person. For people because there's the inpatient and the outpatient rehab. So you cannot compare someone that has been using for 10 years and someone that's been using for a year. Of course, the person that's been using for a year would get better faster than the person that's been using for 10 years. And you will not even trust the person that's using for 10 years to be on outpatient rehab because there will always be the temptation to use. So the standard practice, at least 90 days. We've seen people that have been in rehab for more than 90 days. We're talking of 6 months, even a year. I once managed someone that was in rehab for a while, for a year. So usually, when you want to discharge patients out of inpatient, you do what we call graded exposure to the outside world. So on his first day stepping out of the facility, he took a walk round. He came back. He was like, oh boy, I can't do, I know fit. Like, why? He's like, he had a lot of triggers. The smell of cigarette was a trigger for him. This other thing was a trigger for him. So he opted to even stay longer. He said for an additional 3 or 4 months till he had the right tools to be able to leave. Right? These residential treatment programs provide intensive therapy and support. Another treatment option is the outpatient rehab. This is when counseling and therapy sessions are done while allowing individuals to live at home. The disadvantage of this is that they can easily still go out. Imagine telling someone, okay, you're going to be coming to see me 3 times a week. They come Monday, Wednesday, Friday. They come on Monday, they go and use on Tuesday. They come and see you on Wednesday, they go and use on Thursday. So it doesn't really work. I wouldn't really advise that. But another thing that you can use to increase the intensity is what we call the intensive outpatient therapy, where they come every day, Monday to either Saturday or Sunday. They come in the morning, leave in the evening, come in the morning, leave in the evening. With that, you have a better grip of the person, and you know that, it will be very difficult for this person to use. Another recovery option is therapy, the cognitive behavioral therapy, the CBT. I'm going to talk about it when I'm talking about the recovery options in behavioral health. So the CBT, that's the cognitive behavioral therapy, and other forms of counseling are used to address underlying issues and develop coping strategies. Trained providers usually provide this service, most times the psychologist. Another recovery option is support groups. We have programs like the 12-step programs, the Alcoholic Anonymous, Smokers Anonymous. All this provide peer support and accountability. Sometimes seeing people that have the same struggles as themselves makes them know that they are not alone. Most importantly, the last recovery option is the aftercare. Need support after treatment program to prevent a relapse. It's good to know that this can last for a very long time. So a lot of times it can even last longer than the inpatient rehabilitation. So it's done on designated days. They come in. You can also do random urine drug testing. This helps keep them in check and also maintain sobriety. Like I said earlier, the most effective approach involves a combination of these options, and it's usually tailored to the individual's needs and circumstances. So for the recovery options for behavioral health issues, and there are various methods that are available to help manage behavioral health issues. Treatment is individualized. What works for one person may not work for another person. Some strategies or treatments are more successful in combination with others. So it is important for this individual to work closely with their health specialists who can help them identify their needs, provide suitable treatment. So psychiatrists, psychologists, psychotherapists, and some other primary care physicians carry out these treatments. So some of these recovery options can include psychotherapy or what people call talking therapy. And which some of them include the cognitive behavioral therapy, CBT. This is used for a wide variety of concerns and conditions. It focuses on how thoughts influence mood and action, as well as on how one can build thinking patterns that will help improve quality of life. CBT sessions allows people to walk through solutions to their concerns with the help of their therapist. There's CBT depression, there's CBT anxiety. We also even have CBT for insomnia as well. Another form of psychotherapy is the acceptance and commitment therapy, ACT. This is a therapy that uses mindfulness techniques to help people change their behavior and their mindset. The goal of this ACT is to help people learn acceptance and flexibility so that they are able to face new and challenging situations when they occur. Another form of therapy we use, though not very common, is the exposure therapy. These are treatments used for conditions such as anxiety and trauma. It involves exposing people to feared situations but in a safe and controlled manner so that they can better manage the situation and face their fears whenever it happens. So the second recovery option for behavioral health issues are medications. There are some psychiatric medications prescribed by a qualified healthcare professional to manage symptoms of conditions like anxiety, depression, mania, bipolar. But these medications may also help a person manage their social interactions and routines. Another recovery option is lifestyle changes. Healthy lifestyle changes like exercising more, good nutrition, stress management techniques like deep breathing exercises, meditation. This can all be used to complement other treatment approaches. Still on the recovery, another recovery option is the inpatient or outpatient programs. Sometimes intensive inpatient treatment programs may be necessary for severe or acute conditions, while outpatient programs offer more flexibility for individuals with milder signs and symptoms. We also conflicts and strengthen support. The person started using to pain stemming from what he saw his father do. So during the course of treatment, family sessions were done for this person. In fact, the first one was quite heated and it was very emotional. His father was shouting, mother was crying, sisters were crying, the patient himself was shouting. So it was at some point, the dad he walked out. I was like, I can't do this. But with time, when they did the second one, the third one, there was better communication. The dad said, see what you saw, but in actual truth, look at how it was. So you see that the boy had been carrying a lot of resentment and a lot of hatred towards his father that he shouldn't even have done in the first place. So now that he's better, I saw speaking to his family, they say, my brother and my dad, they're now best friends, or they can't even do without each other. So this is something having a family therapy session could do. Support group, another one is support groups. These are peer-led groups such as an Alcoholics Anonymous, depression and bipolar groups, and there's a new one that I'm trying to form, a Better You female support group, where issues. So joining support groups as these always provides encouragement and accountability. Last but not least, self-help resources. There is still room for self-help for self-help sometimes. Sometimes when people like this do some work on themselves, it tends to stick better. So you can look for books, look for online resources, apps that can provide information and tools for managing symptoms and maintaining wellness. In conclusion, as with recovery from drug abuse, a personalized approach that addresses individual needs and circumstances is most effective. It is essential to seek professional guidance and it's essential to seek professional guidance to determine the best course of action. I'm going to end with this. I will end with this quote from Mariska Hargitay. Healing takes time, and asking for help is a courageous step. Thank you so much for listening to me.
Thank you very much. Awesome, Dr. Shizom Ugona, our guest speaker today. We appreciate indeed, as we often say here, you have given a good account of your professional standing, and we're glad quite a number of people as indeed learned or benefited quite a lot of takeaways from her presentation. But then we're not done yet. We still have the next hour to interact and share ideas, share experiences, and also ask our guests questions. So let's allow Dr. Shizom to get take a glass of water so that's to calm down, and then we'll begin. But before we get asking people to ask inviting people to ask questions or interrogate our presentation, let me quickly acknowledge all of those all of our people, compatriots joining us from across all the platforms, those on Facebook and those on YouTube. We appreciate you. But then let me quickly mention a few names of some of the people that we have on X here. Okay, top there, it's a senior member of this platform, Dr. Kemi Olundoyo. Dr. Kemi Olundoyo, thank you for being part of our conversation today. We also have Ibrahim Kuru. Ibrahim Kuru is joining us from the Northeast, and I'm sure Ibrahim Kuru would has been trying to come on the speakers corner, but I think his network is struggling with his network there. But then we appreciate your being part of the conversation today. Moraki Kayo Ayila, thank you for being part of the conversation. Blank Mind is a regular member of this space. Also, Muhammad Bafo is a regular member. Dochi, Farouk Tanimu. Tanimu is also a regular member of this space. Erile John, thank you for being part of this conversation. We also have Omolara at Commander-in-Chief. I don't know where Omolara is commanding, but then thank you, Omolara, for being part of our conversation today. Auntie Kemi is a school proprietress, I think that in Abuja here. Thank you, Auntie Kemi. Just Omar, Nena Uboni, Baba Bala Castina, LV the God, thank you for being part of the conversation today. Tajuddin Abdurazak, Jimmy, Zanabuka. Zanabuka is a regular member on the space. Kem, that's our own Kem Patriot. Thank you, Kem for. We have also seen Inik Zozo, another regular member joining us on the handle of the organization Drug Abuse and Illicit Sex. Thank you for being part of this conversation today. We also have Eternal Optimist. That's awesome. What an encouraging word there. I am fair. Thank you for being part of the. Also, another regular member of the platform is Prince Eshimokai. Prince Eshimokai, thank you for joining us. We have Soso Ajoke Foley, and we have a commander of the agency. That's indeed our Kwara State Commander, Bashir Ibrahim, joining us from Kwara State. We have Abualu Joseph, Iranshe Eledumare, Usma bin Afan, Patrick Konde, Bakare Abiola, Altafa, Pastor Jeff. Pastor Jeff is also has been our guest on this space before. Father Zil, that's Damin Eduboy, Rukundo Benjamin, my colleague Rita Okwe is joining us from Lagos. Babatunde Fashola, Comrade E.F. Mustafa, and a host of. I mean, as we go, we may still have some time to acknowledge more people. But now let's. Okay, I think I've also seen a senior member of the platform also stepped in. That's Dr. Abdullah. Dr. Abdullah is of the Ahmadu Bello University, Zaria. He's joining us on the handle of Excel Mental Health Foundation. Thank you very much, Dr. Abdullah. I can almost certainly vouch that he will never. Your network is. I'm trying to approve your request, Dr. Abdullah. I don't know if it's your network, you may have to exit and come back again. I would always approve your request to speak. Thank you once again, everyone, for being part of this conversation. Wherever you are joining us from across, Nigeria, Africa, Europe, Asia, and the Americas, we appreciate you. Whether you are joining us on Facebook, YouTube, and live here on X Space, we appreciate you. Now, let's get down to the interaction, and I would invite our senior compatriot on this platform, Dr. Kemi Olunloyo, to give the first shot. Dr. Kemi, please go ahead.
Not much to say. Chisholm did an excellent job. But what I wanted to say, Chisholm, thank you so much for coming. I want that presentation you did in a forum like a school or a community. I did that in the 90s in America. It doesn't take a lot. I walked into schools in Lagos and did all these things. That presentation was absolutely needed in that kind of forum. If you can go to maybe someone, a principal in a very major big school, just tell them you want to speak. Like they do these PTA meetings in Nigeria. They do it in America and UK too, Parent Teachers Association meeting. Like a forum where like maybe you'll enter a school, tell the principal what you're interested in doing. Maybe we pick a 6 p.m. to 8 p.m. in a weekday evening. Students will be there, parents will be there. This is a presentation that should be heard with parents and children. She covered everything, Mr. Babafemi. Chisholm, thank you so much. Your presentation was excellent. And on that note, let me just round up by saying what I tweeted last year, or was it 2022, when I was doing my own campaign on the streets of Lagos about Alimosho local government. It can still be going on everywhere else. But what Chisholm said about checking your children for different things, weight loss, those are signs of things like crystal methamphetamine, and primary ice, the same thing. That causes drastic weight loss. You lose your teeth. Watch your children. Ali Musho had a rundown building, like a building that's uncompleted, and kids will go in there, 12 to 16-year-old kids, boys, to go smoke marijuana after school. And then when they're done, they go home. So I alerted parents, like, if you have kids in Alimosho, they really spread it for me on Twitter. Smell their uniform, because all this know that, okay, I have to wash my uniform when I get home. Smell it before they wash it. Some of the children are smelling of weed. They have a place they go, they meet in an uncompleted building, and then they go home. So it's important to check your children. Do your own assessment before you go to the doctor, to the medical professional. Do your role as a parent. Thank you, Ms. Chisholm.
Thank you very much, Dr. Kemi.
Thank you very much, Dr. Kemi. Okay, that's Dr. Kemi Olunloyo joining us from wherever. She could be in Maryland, she could be in Ghana, she could be in Kenya. All right, that's that. Okay, let's take the next.
I'm still in Mauritius. And just to let everybody know, Mauritius, the beautiful East African island, frozen everything. It's now infiltrated with drugs. Please read it online. That island is struggling with drug abuse, 1 out of 3 households. So I'm working with the people here. Thank you.
We wish you all the best. Enjoy yourself and having some good time there.
Thank
All right,
you.
all right. Thank you. Okay, let's take the next contribution. Let's invite that's Patrick Conde. Patrick Conde, are you asking a question or a contribution? Please go ahead.
I just want to make a contribution. It's very good work that the NDLA is doing. But one basic fact we need to understand that for nobody chooses to be an addict. There has to be an underlying factor that makes someone to be an addict. So understanding that one, it's a very delicate in Nigeria given the situation. But what I will say is that part of the recovery part of being an addict is I've been warned. I live in the UK. I've been warned. See, medications, all these drugs that's one of your speakers mentioned about, all those drugs, they bring on another drug, and it's just making money for the pharmaceutical companies. The way I got recovered was my daughter, she said, "Oh, Dad, you know, after divorce, Dad, you need to, get yourself back together. You're drinking too much." I had to go to a rehab. And in rehab center, I stayed there for 3 months. And when you get there, there is no methadone, nothing. You go there and you go like a cold turkey. We call it cold turkey. Because when you give people methadone to get them down from whatever they are taking, you are addicting them in the use of methadone. So the best bet is if we can have like a rehab centers. These rehab centers, they will not be sitting by just like that. They'll be going out doing activities. I was just like, we give out leaflets. We work on old furnitures to make it look nice and, sell it to make money for the organization. So I think, yes, we need to, the root of the matter is what is causing the addiction. And then the solution, it has to be rehabilitation, not drugs. Because when you keep pumping people with drugs, you are putting them on another drug, because all drugs have side effects. So, well, thank you very much, NDLA, for the jobs you're doing. Appreciate you. Remain blessed. God bless Nigeria.
Thank you very much, Patrick Conde there. Okay, Dr. Shizom, obviously Patrick is very pretty much against MAT, that's medication assisted treatment. So let's
Where I work, what I ask for is and I'll say, "Oh, can't you give me this medication? Can't you give me this other medication?" That they told them that they are going to give them an infusion or drip, as they call it in Nigeria, that would flush out the whole thing. I explain to them that it doesn't work that way. So yes, some medications may have addictive tendencies, just like treating someone for ADHD. There is a user. There are some ADHD medications that are stimulants as well. So you have to now start looking for an ADHD medication that is a non-stimulant that would help someone that has ADHD. So I completely agree with him and with Mr. Patrick that the best way to do it is actually cold turkey, and they may have, like I said earlier, they may have some challenges with some symptoms. So the best thing is to treat symptomatically. Someone that is vomiting, you can give an antiemetic. Someone that has diarrhea, you can give something for it. Someone that just treats symptomatically, but the best is cold turkey. So I also agree with him. Thank you.
all right. Thank you there, Dr. Shizom. I'm sure Patrick will be glad to get that feedback from you. Okay, let's take the next contribution from. Okay, let's invite Comrade. Sorry, I'm trying to get. Okay, Comrade Mustafa. Comrade Mustafa, is there a question or intervention? Please go ahead quickly.
All right, thank you. Good evening to you, Mr. Babafemi. Thank you, the NDLE, for this program. This is quite interesting. I would like to contribute a little before I ask a question. Going by what is happening in our country, you look at close to 60-70% of the youths are actually involved in drug abuse, and the result is quite clear. It's clear everywhere, and I hope this program will bring some form of relief on that. And to the Mrs. Chisholm, sorry, I want to ask you this question. How do we really spot out the early indication in children, especially children? Like Dr. Lukemi rightly said, that when children are actually coming back from school, you sniff their school uniforms. Yes, because it happens. Some of them you do not believe what they are into and the kind of company they keep. So, what are those early signs? I want you to really re-emphasize on that. Thank you.
Thank you, sir, for your question. So some of the early signs you may see in kids, just some of them, could be as a result of their school works, their school grades dropping drastically. Someone that used to do so well in school, all of a sudden starts getting absurd and very poor results. You should ask questions on what is happening, what's going on. Do random searches in their rooms, in their bags. That was how a mom found marijuana in her son's bag. Just randomly search their clothes, like Dr. Kenny said, sniff their clothes, sniff their mouths sometimes. You can notice it in their eyes as well, when they have some like glazed over eyes, this blank look. Unexplained injuries as well could be another early sign. Abrupt change in their weight. They're losing a lot of weight. Change in speech. For people that use codeine, they tend to talk very slowly, slurred words. Sometimes it could also be a rapid rhyming. They're talking a lot, talking too much. Another early sign is having a problem with recall. They tend to not recall things. You can't remember things. So these are 1 or 2 or 3 signs you can see in children as well.
All right. Thank you very much there, Dr. Chisholm. Okay, let's take the next contribution from, I see Rokundo. Rokundo, you've been going off and on, so let's quickly yield the mic to you before your network takes you out of the speaker's corner again. Rokundo, please go ahead.
Yeah, thank you very much, Mr. Femi. I don't know if I'm really loud and clear.
You are very loud and clear. We're hearing you globally.
All right. I'm by the names of Rokundo Benjamin, and I'm coming to you live from Uganda, Kampala. That's the eastern part of Africa. To you, my brothers from Nigeria, how are you doing? I hope you're really doing great. I'm so happy. I'm so happy that I've actually come on this space, and we are sharing a very good topic that says drug abuse and behavioral health, early signs and recovery options. I'm as well and a business and IT consultant, so that's what I do. So when I saw the topic, I really said I cannot fail to share in my knowledge about drugs and then all that in matters mental health. So, first of all, drug abuse to me is something that looks at excessive use of psychoactive drugs such as alcohol, pain medications, or illegal drugs. Sometimes people consume all these substances and they find themselves in a state that they themselves cannot also explain. Most of the time when someone is high on a drug, it is not the real person you're seeing, but now they actually change, just like the way you see a chameleon changing colors. You see that it is green, but when you put it on something yellow, it really changes. So you're actually not dealing with the real person while he's sober. The moment he gets high, it's always advisable that you really stay very far away from this person, because anything can happen. They can actually cause danger and even damage you as a person. So what are some of the signs of drug addiction? Now, some of the signs we have is an urge to use the drug every day. You find that you cannot really go a day without having to administer this drug into your body. Some people have actually reached an extent of having to inject these drugs into their blood system. Someone is like, not until I inject myself, I don't think I can get sleep. Not until I do something to my body, not until I take a full crate of beer, I cannot find sleep. Some people even, it is so sad that they can only get the confidence to engage in dating or in relationships only after they have actually consumed these drugs. So at the end of the day, you find that these drugs have become part and parcel of their lives. So that's one of the signs of addiction. And then another sign is taking more drugs than you want to and for longer than you thought you would. Some people have been actually given medical treatment and administered on a particular drug, that they should take it at such and such a time, but before you know it, someone is taking an overdose. And when you take an overdose and you consume it, definitely it will leave your body not in the same form. And then there is also always having the drug with you. Now there are some people that have always carried these drugs within their bags, even when it is not necessary, even when he has been told that you're supposed to take this drug early morning and then late in the night. To my surprise, when they are leaving home, they still have to carry their bags together with those drugs inside. So that means this person, in one way or the other, has become an addict. And then there is also spending more time alone. The moment you see someone spending most of their times alone, when you sense someone becoming a loner, and they have always been a people's, social person, then that means there is something that is actually happening in this person's life. And then there is also not taking care of yourself. So the moment you see someone not caring enough, like now for me, people are used to seeing me very neat, people are used to seeing me elegant. So the moment I go silent, or the moment I'm not audible out there, then people know that I think there is something that has happened, because people are used to the real me, someone that is audible, someone that is elegant, someone that wants to articulate issues, So every time you sense a change in behavior, then you really need to ask yourself what someone is doing. If someone is unable to take a shower, or if someone is unable to even keep their hair tied, then you know that there is a problem. And then also
absolutely. Let's wrap up now, Rokundo, quickly.
Yes,
Go ahead,
please.
wrap up, please. Go ahead,
yeah, I'm wrapping up.
Yes.
Yeah, then there is also someone doing dangerous things like driving while they are high. Someone is already drunk and then you see them on the steering wheel. Definitely the next thing would be you getting engaged in an accident. And then there's also having unsafe sex. There's no way you can go out there in a band, then you meet someone for the first time, and then you're having unprotected sex. I mean, you've not done all these checks and balances. You've not done the HIV test, you've not done, all those STIs, and then you simply go unprotected. Then that would mean someone is really high on a drug. And then just to summarize the recovery options, someone you can recover through communication and engaging in interpersonal skills. Try to talk about your problem with someone you trust, and then they can guide you through the process. And then also have self-control, because it's you that started taking the drug. I really believe the power to control and regulate yourself when it comes to taking that drug still lies within your hands. And then lastly, you need to also develop the resilience and ability to cope. Believe you me, the moment you have all these things that we have talked about in check, then you are on your way to recover from drug abuse. Thank you very much for the space.
Awesome. Thank you very much, Rukundo Benjamin. Rukundo Benjamin joins us from Kampala, Uganda, sharing his own experience, his own understanding, as well as his own idea about some of the early signs as well as recovery options. We appreciate you once again, Rukundo Benjamin, for being part of this conversation. Thank you very much. I'm not sure, Dr. Shizom, would you want to say anything to that? Or we should slide? Please go ahead.
We can slide. He's said a lot of things. Thank you.
All right. Thank you very much, Dr. Shizom. Okay, let's take the next contribution from Daddy Felix, right? Daddy Felix, question or contribution, please go ahead. Unmute yourself and go ahead. Yeah, Daddy Felix, can you hear me? Okay. He slipped off. Okay, let me quickly go to. Let me reach out to those in our DM. Let me get some of their feedback. Okay, some of their questions. Okay. Okay, Ibrahim, you are back here. Okay, Ibrahim, Ibrahim, can you hear me? Okay, Ibrahim, just signify where your network is stable. Let me know. I'll come to you quickly. But then, before I get to you, let's take this one from I'm trying to skip some that had already been taken care of in the course of her presentation. The early signs that someone might be developing substance abuse and addiction impact in chemistry, and that shall be answered all through family and friends. Okay, Janet is asking what role should family and friends play in supporting someone through someone struggling with behavioral issues, drug abuse and behavioral issues through recovery journey. Okay, talking about the interventions by family and friends. That's it, Dr. Shizam. Please go ahead.
Okay, thank you, Janet, for that question. So the role family and friends can play is, first and foremost, a lot of people don't even understand what a substance use disorder is, what an addiction is. By the time they understand that their friend, their family member can't help themselves, it's not as if they want to do it, but they just see themselves doing it. It's actually an illness. Substance use disorder is an illness. It has to do with the brain, neurotransmitters. It's a brain thing. So when they understand the pathways and the pathophysiology of an addiction, then with that understanding, they know that, okay, our brother needs to be helped, our sister needs to be helped, our friend needs to be helped. All right. So when they understand it's not, and sometimes you see parents, friends shouting, "Oh, why you keep doing this? Why are you smoking this?" So understanding and giving them the maximum support. Find them help when they need help. There are lots of rehabs or even professionals you can reach out to. Oh, see what I noticed. My brother needs help. My friends need help. So just being there and being supportive, even though you don't know what to say, just being there alone is enough for people to recover. And I've managed someone, all he kept saying is, I need my wife's support. And because his wife was angry, why are you doing this? Why are you using this? So for his first 2 months of rehab, there was no progress. We were still in where we were, no progress at all. But I asked him, and I was like, what's the problem? He said, just talk to me. He said, that he's only thinking about his wife. He thinks his wife is going to leave him. That's all his thoughts are focused on. And I told him, so if your wife comes and gives you maximum support, are you going to do this program? He said, yes. So I reached out to his wife. I spoke to her. And she said, I explained it to her. She was like, okay, that she was going to come. So when she came, we spoke to her. She spoke to her husband as well, hugged and kissed him, and we saw a different person moving forward. He was more focused, took his different sessions seriously. So there's nothing like a support from family members and friends. It goes a long way.
All right. Thank you very much, Dr. Shizom. Okay, we have quite a number of people on this page. Okay, but let me quickly acknowledge Obadina. We have Obadina. Thank you for being part of our conversation today. We have Chinuke Dewu. Chinuke Dewu joins us on the handle TK, and she's equally a medical practitioner joining us from Maryland in US. Thank you, TK. We have Suleiman. Suleiman is a regular member of this platform. We also have, like I already acknowledged, Daddy Felix, and as well as Dr. Abdullah. Dr. Abdullah is a senior member of this platform. We also have Adebayo Sadiq Ishola. Thank you, Adebayo Sadiq Ishola. Okay, let me pause there and take the next question from DM. Okay, let's. Digba is asking. Okay, I'll just read at a go. 2 out of the 3 questions Digba is asking. The first question is, what are the challenges that arise when treating individuals with both substance abuse and mental health issues? That is one. Let me skip the second one to the third one. The third one is, how does addiction impact brain chemistry and behavior? I'm sure you have also answered some, but you can then still take respond to Digba. Thank you, Dr. Shiza. Go ahead.
Okay, so what are the challenges arising from treating both substance use and mental health issues? So when someone has a substance use disorder and a mental illness, it's something we call co-occurring illness. It can happen when someone is using, like, I'm going to put it in 2 categories. Person A has tendencies to have mental illness and it's just dormant in the body. By the time they use substances, it sort of brings out the mental illness. We're talking about psychotic symptoms. They start talking irrelevantly, seeing things that are not there, hearing voices. So most times they tend to live in denial, like, oh, okay, this is not from this is from this. I had a lady come in. Her son took marijuana and some other things and started exhibiting some psychotic symptoms. He was placed on some medications. But delving deeper, he never told anyone that from secondary school, he had already started hearing voices, being paranoid, some call paranoid delusions, thinking people want to hurt him. This was on further probing. So I told the mother that, yes, his current episode is from the substance he ingested, but look back that he has had this kind of psychotic symptoms even when he was in secondary school. So sometimes denial can be a challenge, but it is treatable. A lot of times you can treat both. As you're treating, then rehab, getting detox, and you're also treating the mental illness. So by the time you discharge them, they're coming back to do outpatient programs for both of them. I know it can be quite challenging, but recovery is also doable. And how addiction affects the brain chemistry. So like I said, there are pleasure points in the brain. Yeah. So when, just like Fanta that is sweet, I taste Fanta, my brain has registered that Fanta is sweet. I taste bitter leaf water, is bitter. Of course, the brain will want to go for the Fanta all the time. That's the way addiction works. It wants to be pleasured with something sweet. That high, the brain wants to feel that high. And it happens at the part of the brain called the amygdala. So that's the part of the brain that is mostly affected. So by the time they keep using and using and using, there's a damage. So but when they stay for a while, they stay for a while for rehab, their brain heals. That's why there's always also a risk of drug overdose, because they've been without it for a while, their tolerance level is down. So by the time they go back, some people go back and use again, it leads to an overdose. So it's everything has to do in the brain with the brain. So by the time family members and people understand that it's a form of mental illness, it goes a long way.
All right, thank you. Once again, Dr. Shizam, we're gradually pushing towards the hour that when we'll be drawing the curtain on today's edition of our conversation on X Space. Okay, let me again quickly acknowledge some of those joining us from across the world. We have, wow, this name is funny, son of a well digger. Thank you for being part of the conversation today. I'll come to you shortly for your question or intervention. Funsho Jimo, thank you. Ogasolo, thank you. Sunday Clement, thank you. Mike Foley, thank you. Abdumali Koya, thank you. Citizen, thank you. Makanju Olataiwo, thank you. Hussein Kende, thank you. Would like to once again acknowledge all our people on Facebook and YouTube. I may not be seeing you directly because I'm focused at the moment on X here. So please just know that we recognize you and we appreciate you. All right. Quickly, let's take the next from Son of a Well Digger. I would like to appreciate if Son of a Well Digger can give us an insight into what that name is, what that name means, and then go ahead with his or her question. I mean, definitely is his question or contribution. But go ahead, Son of a Well Digger, mute yourself and let's hear from you. Okay, he's off. He's off there. Okay, let me go back to read. Take some more questions from DM. What is this? What are the common changes, etc. Just going through anyone that has been answered. I'll have to skip that. What role should family and friends play in supporting someone through? I'm sure that one has also been answered. What are some of the early signs and that? How can someone differentiate between experience? Okay, this one is from Obong. Obong is asking, how can one differentiate between experimental drug use and problematic drug use? Dr. Shizom, you got that?
Yes.
Okay, please
So
go ahead.
it depends on what my experimental drug use. It's subjective. One person's experimental drug use may be different from another person's experimental drug use. So when someone is experimenting, oh, you try codeine today, maybe you don't like the taste. You try marijuana, or you don't like the way it feels on your chest. You try nicotine, you don't like. So you're just jumping from one substance to the other. All right. So the risk of this is that as you're experimenting, you finally reach the one that's all goes well with your system, and you start taking it. You probably love the high, or this helps me sleep better, or this helps me eat well. This, different things. So this is all this experimentation is just a way. The brain is a very deceitful organ, right? It can keep saying, "Oh, try this. Let's try this. Let's try this one." Once it gets to the one that it likes very well, that it leads to drug abuse of that particular drug and a full-blown addiction. Whereas the other one, he said, that is when all the signs that we've mentioned are there, and even some more. Okay, then sometimes you may even see some psychotic symptoms, like I said, and this is what will now point out the fact that they use medications. So experimental drug use is very subjective, and it would most likely always lead to getting addicted to a particular drug.
Okay, thank you there once again, Dr. Shizom, for that intervention. Let me take the next question from what are the signs that can help and learn to know can you please tell us the best recovery options to help dog within our words? Treatment, I'm sure what else from drug addiction treatment are available. I'm sure. Okay, Lawa Chidima is asking this. Can you please break it down further for us? I don't know if I'm just if she has said this before, but can you please break this down for us? The best recovery option suitable for a parent who is on drug, and what's the likely duration of treatment, because he is the family provider. Okay, Dr. Shizam, did you get that?
Yes, I
I
did.
think this person is probably talking from a personal experience. So
Yes. Okay. So to answer that question, there's really not one or two or three. Most times they work in combination. For someone that is a family person and a provider, the best, and it's also dependent on the particular drug the person is abusing. It's also dependent on how long they've been using. It's also dependent on the severity. So there are a lot of factors to consider when trying to choose a particular treatment option. But most times, if it's a lot, we usually recommend detox first. And to do detox, effective detox, you need to be an inpatient. Outpatients may work or it may not work because they're leaving, they just come and they go. There's always that tendency to use when they leave the facility. So I always usually recommend detox in-house. And you could do detox 4 weeks, 5 weeks, it depends. It's all subjective. Then the particular number, the number of days the person stays, like I said, at least 90 days. At least. It could be more. So after what professionals do is after 90 days, they reassess the patient, how far the person has come, what the person has done. Does the person even understand their triggers, things, and what is also their recovery plan? Do they even have a recovery plan? If you leave today, what is going to happen? So most times, I recommend inpatient. Yes, it's difficult because you have a family. I had someone here married with kids. He found it difficult to come for rehab. He said this same thing was his problem. Oh, I have a wife, I have a 2-year-old son. I know I want to get better for my family, but I can't leave them. So what I did, it should be tailored to individual. What works for A may not work for B. So what I did, I knew he really wanted to come for rehab. So what I told him was like, okay, why don't you stay here? Then every weekend, I can allow it. Friday, Saturday, Sunday, they can come and visit you. Would that work? And he goes, oh, okay, no problem. Another person that needed intimacy with his wife, there are some rehabs that allow couples to stay together, right? That happens as well. So it's tailored specifically to an individual's need. There's really no clear-cut pathway. So this is something you need to talk about with your health professional, and there are always ways to work around this. Thank you.
all right, thank you there, Dr. Shizam. Okay, let's invite pass the mic to Robin before we go back to some questions pouring in our DM. Robin, if you can hear me, please unmute yourself and let's hear from you quickly. Robin, okay, if Robin is not ready, let me read this from DM. This is from John. Okay. That is one. Two, from your experience, what's the long-term solution to the problem of drug abuse in the face of high costs of treatment? Okay, there you go, Dr. Shizam.
Okay. All I can tell you that where Oliester is affordable, we can work with any budget. So maybe you can reach out to me and I can discuss that with you. And for the long-term solutions for someone, I know that mental health can be because of the way it is in Nigeria, it could be quite expensive. So if you want to go to private facilities, they could be expensive. And going to government facilities that are more affordable, a lot of times people may not want to go there, right? The medications for mental illnesses, they're even more expensive than um, the normal malaria and typhoid medications you see. So one of the things we advocate is, even though they're expensive, you need them, because there's something called relapse. If you don't take these medications as prescribed, there will be a relapse. And most times when there are relapses like this, it takes a longer time to get better. All right. And when there are repeated relapses, to get back to your very first formal state will take a very long time. Yes, it can be expensive, but when after being treated, you're placed on medications, you get well, there's a maintenance for a while, and then gradually, if your physician sees the need to taper it off, it can be tapered off gradually, and you eventually stop. But also understand that even minus the medications, these outpatient sessions are very important. And again, individualized. You have to work with the individual. This is what I can afford. Some people can afford coming for their aftercare plan 3 times a week, 4 times a week. Some people want to come every day. If they can afford it, fine. But if you're working with a budget, you can opt to come, okay, once a week. I can come 3 times a month. But that aftercare is very important. Thank you.
All right, thank you, Doctor. Okay, Robbie, you are back. Are you ready? Otherwise, I have questions I'd like to read from our DM. Okay, if she's not ready, let's take this one from Haruna. Haruna is asking, okay, a lot of people okay, let me not skip that. Let me acknowledge, let me read his acknowledgement. We appreciate that awesome presentation from Dr. Shison. Very, very exciting. Okay. A lot of people are going through a lot in their places of work, and as a result are going through depression, mental health challenges, and drug abuse, and yet they still appear neat at work. How can colleagues and employers identify these people, and what should be the appropriate response? All right, thank you, there. Please go ahead, Dr. Shisa.
Okay, thank you for that. If you recall when I said in the beginning about high functioning addicts, there are people that use but appear normal to people outside. They have a way of masking whatever it is they are going through. However, there could be telltale signs. Yes, at work, you could see that they are functioning less. If they used to bring, if their productivity was 100, it somewhat reduces to like maybe 70, 60. They're still working, but it's reduced. You see them dozing off random places at work. One person said that how he knew his colleague was using was he was always going to the restroom. So he asked him, guy, this one you do always go this thing, what's the hero? No. So one day he tracked him, just followed him randomly, barged in and saw him sniffing powder, and that was how he knew. So another sign is having blank, this blank stare, staring into space, the concentration level low, they can't really concentrate, they can't recall, they can't remember things. For people with anxiety and panic disorder, they can't give their presentations, they have tremors, they're visibly shaking, they are sweating, they have abdominal cramps. These are ways to identify someone that has anxiety. And for depression, even though they are coming to work, their mood is always low. They crack jokes. This is someone that used to be very lively. They're at work, but they're going through a lot. They don't laugh. They become more withdrawn. their energy level is low, concentration level is low. So these are some of the things you can pick out. Though it may be very difficult to pick out some of these things in people that appear to be normal, but when you look closely, you can still see some of them. Thank you.
All right, thank you, Dr. Susan. Okay, let's take this one also. This is BE. BE is asking, are there definite clear-cut differences between mental health and behavioral health challenges? I think that's straight. Please go ahead, Dr. Susan.
Okay, thank you. Again, they are interwoven. A lot of times they are used interchangeably. Behavioral health, mental health. So understand that under behavioral health is broad. There's mental health in it. There's substance use disorder still under behavioral health. There's lifestyle. There's stressors. There are crises. So all these are under behavioral health. Though once in a while we may say they are the same, but looking closely, mental health is still under behavioral health.
All right. Okay, let me take this one also. This may probably be our last take. Okay, Ahmed. Ahmed is asking some of especially the Gen Z and millennials, dress abnormal these days. Is this tantamount to behavioral health challenge, or how deep can one look to be able to spot uh, this in these young people on the streets and on campuses?
Oh yes, that's a funny question. Yes, I know there are a lot of dress code people. People like to dress in a certain kind of way. They could be normal, but they could also be pointing to something being wrong. Let me give you an example. I've managed someone in the past. She works, so most of her attires are formal wears. Yeah. So how her family knows that she's having a mental breakdown is if she just goes to shop, she picks a color, she buys all white outfits, and she starts wearing white outfits that are, distressed jeans, things that she would not wear on a normal. That's when they know that, oh, okay, she has lost it, to she's probably not taking her medications or something. So yes, dressing can indicate some form of mental illness. However, we should learn how to differentiate it and isolate it. You can look out for other signs like the other signs I said. If they are there, yes, you can now say, okay, this person has this or has that. But it could be dicey trying to use just mode of dressing. Even with the mode of dressing, did they shower? Because a lot of times addicts don't even want to shower. Did they shower? Did they brush their teeth? Did they comb their hair? They look unkempt. So these are other things that are telltale signs that you can check, even with or without the dressing.
All right. Hi. How many people can we still give? Okay, let me just take this from those are already on the space. Okay. Josuche, quickly, please. Quickly, where our time is fast spent. Josuche, if you can hear me, please unmute yourself and let's get your contribution or question.
Okay, hello, good evening.
Yes,
Hello,
go ahead. Good evening, we can hear you.
Okay, it's more of a contribution than a question. I want to commend the team for this program. But what I will say is that yes, early signs and recovery option, behavioral change and everything can actually pinpoint early signs, and pinpointing these things will help us actually achieve eliminating it. So there are signs that you can look out for, like what Chisom just said a couple of minutes ago, where she talked about somebody having to just go on the shopping spree. It can just be their resentment towards some certain things.
Sorry, is it just me, but I can't really hear. I can't hear anything.
Okay, sorry, can anybody hear me?
Yeah, I can hear you. I can hear you. I think that something is making a loud noise in wherever you are there. But then go ahead, John Sushe.
Okay. Right. Early signs, such as resentment towards some certain things, you see them, they are actually to themselves, or they're hiding a lot of things. Mostly, especially when you talk with early addiction, realize that there are things that they don't do before. They know they start doing it, being secretive and other things. These are signs and behavior that we should actually check out for, that can help us curb this drug abuse. I believe yes, it's possible to pick out these signs. And when you see these signs on individuals, you call them up and talk to them about it. And the earlier the better. And that's how I feel for my own. And thank you very much.
All right, thank you very much there, John Sushe. John Sushe just made a contribution, so I don't think we need to get you to respond to that, except you want to respond, Dr. Chisholm. Otherwise, let's have that slide and let's go to let's take Makanju Olataiwo. Makanju Olataiwo, please quickly unmute yourself and let's hear from you. Makanju Olataiwo, are you ready? Okay, if Makanju Olataiwo is not ready, let's take okay, Crown. Is it Crown Power? Please quickly, if you have. Otherwise, I'll give drug abuse and illicit sex the last opportunity. Okay, go ahead. Drug abuse and illicit sex.
Okay, so I really appreciate. Good evening, sir. I appreciate this opportunity. To be honest, the speaker is excellent. Oh wow, the speaker is really excellent. And topics of this nature should be given.
Unfortunately, I'm not sure we're hearing you.
Exactly, I can't hear anything.
Yeah, drug abuse and illicit sex. I will have to mute you. We are not hearing you at all. Apologies. I think you are in a location where your network is not too good. Please, apologies. You have always been a member of this platform. We'll definitely next week provides another opportunity for you to make contributions. We would like to appreciate everyone. So,
Then the
no. Okay, I have to remove you because he's not hearing us. Sorry about that. Okay, let's invite Dr. Chisholm now to give us her final remarks on this space today. Let's have your wrap up, Dr. Chisholm. Please go ahead. Thank you.
All right, thank you so much, everyone, for the questions, for the contributions. And just to say again that recovery from drug abuse is very possible. It could be difficult at first, but on the long run, it will be beneficial to everyone. So just take that bold step and seek help. It's essential to seek professional help and determine the best course of action. It's not as bad as you think it may be. And for parents out there as well, let this be an opportunity to look out for your kids, because if this is curbed from an early age, you see that it will not even be a problem. Teach kids, say no to drugs. If they give you this, say no to it. Tell them things like, so that they know. They have to work with information. If they don't know, they would try it. Oh, my mom told me about this and she said I shouldn't do this. So information is power. Keep reading more. There are a lot of online resources. There are apps. I'm available. I'm very approachable. Whatever it is you need, you can reach out to me and would walk you through your journey. Healing takes time, and asking for help.
Charles, she's been talking with us in the last 2 hours. We appreciate you for your time and for that brilliant presentation and the eloquent response to all the questions. And thank you very much once again, Dr. Chisholm. Dr. Chisholm is a senior medical officer at the Oliesta Recovery and Wellbeing Center, a mental health care facility located in Gwarinpa area of Abuja here. She's been speaking with us in the last 2 hours. I would like to once again appreciate her on behalf of the chairman chief executive of this agency, General Mohammed Buba Mara, retired. Thank you once again. We'd like to appreciate everyone that has been part of this conversation today, all of those who joined us from the US, Tinuka Edo, thank you. Dr. Kemi Oluloyo, thank you very much. We appreciate those joining us who joined us from the UK. That's where is our compatriot? Okay, that's Patrick Conde. Patrick Conde, thank you very much for representing the compatriots in the UK today here on this platform. We also appreciate our good friend there, Rokundo Benjamin, for sharing with us his own experience from Kampala, Uganda. We appreciate everyone. I cannot go through all over all through that long list again. Thank you very much for being part of next week. Provides another opportunity for us to share knowledge again and share facts here so that we can all continue to create this awareness and get people equipped with the right information and right skills for them to be able to take appropriate decisions. Now, working with me behind the scene here, I'd like to appreciate my colleagues, Rita Okwe, Musa, Francis, Blessing, Dele, Val, Phil, Kumbi, Vicky, Inobong, and the rest of you guys. I appreciate everyone for being part of this conversation. And we'd like to inform us that for more details about the activities of the agency, please go on our website, that's www.ndla.gov.ng. You get quite a lot of information about the activities of the agency there. You can also come on to our social media handles, that at NDLA01 on Facebook and at NDLA_Nigeria on YouTube, Instagram, X, as well as TikTok. Until we come your way again next week, I remain yours sincere.
Answer. It be you way say you want mamba. No. Scoosh. No. Good. No. It be you way say you want drama. No. Answer. It be you way say you want loud. No.
Before, science student had nothing on me. Nothing on me. I used to take codeine, mix it with a lot of other things. A lot of other very risky things. Over time the thing go skibbity papa skibbity hey. The